My name is Dr. Kahura Mundia. I'm a maxillofacial surgeon and a lawyer as well. So the reasons why I chose to do these things was because of the things that we were experiencing as doctors in the public healthcare sector. And that was the issues of premature devolution. In my sense, I say it's premature because of the way healthcare was rushed out to be devolved. So what I've been able to do in these last 10 years, I've been able to engage with persons, the underprivileged persons, where I'm able to provide charity work, either on my professional training, that is legal service provision, where we do legal aids in the community of persons who are not able to access legal services, as well as providing dental care services to persons who are not able to do the same. We also do charity work by having persons who have cleft lips or any medical facial conditions, whereby we see patients for free and provide services to help them alleviate their circumstances and suffering. You've seen the recent issues of taxation all over the place. So for us to advocate for the right thing in the society, persons have to speak up. But to speak up, we must know what you're speaking up about. So being in the healthcare sector as a clinician, and being in the policy sector as a lawyer, I'm able to understand better issues that are happening. And I'm able to advocate in the spaces that I'm in by advocating for those services, strengthening of public healthcare systems, as well as fighting for the healthcare labor rights of persons. So not just doctors, we work as well with other bodies to try and see whether persons can be paid better for the value that they do at work. Reason being, we spend about 60% of our time at the workplaces. If the workplace is not the best place you experience your life, where else will you do it? Because if it is stressful, you'll not even be able to enjoy whatever you're paid. So better pay, decent work, and these persons, when they experience all this, they're better able to provide better services to humanity. So I advocate for social justice. We are about 35 maxillofacial surgeons, that persons who fix the face. So anything happening on the face, be it cosmetic work, trauma, fractures, that is what we're dealing. So we are 35 of us in the country. We're quite a small number, and we wish we had more persons, because all these persons who are driving motorbikes, whenever they get into a crash, there is no one to fix them. They're not able to afford such care. So that's why, for my skills and training, I'm able to advocate for better payments for their services, that they can access these services at their facilities, and for more persons in my area to be trained into the things that I've been into, so that they're able to provide and afford these services to our patients, that is our Kenyans. What we've managed to do for now is the aspect of trying to have persons access care. Care in two ways: healthcare services that are affordable, in a way that we push for these services to be strengthened at the public facilities, so that patients can get to see themselves accessing that care. We've been able to lobby to a position whereby now we have new laws in healthcare. We have the Social Health Insurance Act, which has been signed into law. And we hope that with what the Kenya Kwanza government is trying to do, we'll be able to realize the right to healthcare for all Kenyans. So it's a starting point, and as a union, we'd want to keep on pushing the government so that we get to realize that. The other benefit that we managed to get is to have doctors. As per the last 5 years, we had the last strike, which was quite lengthy, and we managed to resolve it in a way that doctors were satisfied with the outcomes of that particular time. But some aspects of it have still not yet been implemented, and we hope that in the coming days, the remaining portions of that collective bargaining agreement will be resolved in ways that we can get much more benefits. When doctors are happy, patients are happy, and everyone is happy. So there's no point to have all this wrangling when parties are disagreeing. On the other side, on my training on legal skills, I've been able to provide and participate in the provision of legal aid services. This is to persons who cannot afford legal services, because again, legal services are quite expensive. So there are aspects of land, there are aspects of domestic violence, there are aspects of people being defrauded, whatever transaction they've been in. And as counsel, we're able to sit down whenever we go to the communities, take interviews, and assist persons in their cases so that they're able to get justice whenever it's supposed to happen. My position allows me to network with other organizations who are able to now listen to what you're saying and propose circumstances that they're able to access these particular services. And that way I feel like I'm helpful to the society in ways that are quite influential. Now, while I was doing my MBA, it was such an eye-opener at that particular time. I was at Strathmore University, and we studied healthcare law. And I wanted to influence policy, how policy was designed. But for you to understand how policy is designed, you also need to know what next after policy design. And that's how now I started to study law. 2 years after that, I went to law school, University of Nairobi, and I studied law. Because I knew, having studied law, I not have to keep on consulting lawyers. Because every time I have to go to do an interview with a lawyer, tell them, this is the situation. Kindly, let's draft this particular bill and let's push this agenda in this particular way. So it was quite hectic, you knowing what you want, but you're not able to fulfill the full promise at the end. So that's why I had to match up my business training with my law degree, then my clinical background. I'm able now to better understand issues in the public healthcare space, or even the private healthcare, because sometimes we see situations that are not friendly, because by design, public healthcare system should work. But you're only able to critique the weakness of the system when you're better trained to understand the flaws. On an usual day, let's say from Monday to Friday, between Monday and Wednesday I run my clinics, that's the surgical clinics and the surgical theaters. So that's when you get to see my cases, between Monday and Wednesday. And then the days when you don't have cases, you'll probably visit the patients in the wards. And when you're free now, you'll do sit down, review your policy, review your cases, and now submit on the legal side. And it's somehow seamless, because nowadays you have a lot of developments in the sector whereby to practice law, you can do it virtually. So whenever you have a court appearance, you probably appear virtually. But if it is on the other side, you will be doing it the old times, that is before Corona times, it was physical. Maybe that it could have been more challenging at that particular time. But now it's much more friendlier in the new changes. And I'm able to balance my time. Sometimes when issues are too many, you delegate, or you consult, or provide advice, and then someone assists you on the area that you're working in. But it is doable. And despite all that, there's still meetings, union meetings, where you have to meet people, and even now plan strikes, plan demonstrations. But this is on the smaller scale, because some county governments, we're still fighting with them. And once in a while, you have to visit the county governments, talk to them about the issues that the workers are facing. When they hear, we resolve and settle that. But when they don't, we still have to push on for strikes. So it's all in the line of work.